Hi, Assalamualaikum and good day everyone. My name is Nur Azina binti Mat Jazli, but all of my students call me Madam Lin, and you can call me Madam Lin too. Today we are going to discuss about mixed method research design. Have you heard about it and have you tried to do this kind of study? I know some of you have heard about it, but you don't have any idea how to do it. It's okay. I will explain to all of you what a mixed method study is. Come. Before we proceed further, here is the outline that we are going to discuss in this topic. First, what is the rationale for the mixed method research? Second, what are the purpose of the mixed method research, especially in the nursing field? And the third one is, what are the types of the mixed method research and example of all these types? Are you ready? Come, explore with me together. Mixed method research involves collecting and integrating both quantitative and qualitative data. This means that this design uses both quantitative and qualitative elements. It uses distinct design that incorporate philosophical assumptions and theoretical frameworks. It provides deeper insight compared to a single design, and this means that this mixed method design can overcome the weaknesses of quantitative or qualitative research by merging the two. And this design also strengthens the quantitative results and vice versa. What is the importance of this mixed method in nursing field? Mixed method research is particularly relevant in nursing because it explores both subjective experience, which is a qualitative, through interview, and measures the outcome, which is the quantitative findings. And this approach is essential for a holistic understanding of healthcare phenomena. For example, if we want to explore home-based postnatal care or mother's recovery and well-being, let's say that we are using only quantitative design, so we only able to gather data on their health outcomes, emotional well-being, and also their satisfaction. But if we explore this with a mixed method study design, instead of we gather that all data, we also able to explore their experience in depth. Here, we use qualitative data to explain and expand on the quantitative findings. Here is the illustration of mixed method research design. It is a combination of a quantitative and a qualitative study. It depends, either you want to start with a quantitative first followed with a qualitative, or you want to start with a qualitative first followed with a quantitative. It can be done concurrently. It still can be called mixed method design. Here are the purpose of mixed methods in nursing fields. First, comprehensive understanding. Mixed method research offers a robust framework for exploring research questions from multiple perspectives. By integrating qualitative and quantitative approach, researchers can achieve a richer and more understanding of complex phenomena. This approach is particularly valuable in fields where understanding context, experience, and measurable outcomes are equally important. Second is enhanced validity. By combining a qualitative and a quantitative data strengthens the overall validity of the study. Combining qualitative and quantitative data can significantly strengthen the overall validity of a study by providing a more comprehensive understanding of the research problem. This approach leverages the strengths of both methods while compensating for single design. The third one is triangulation. Triangulation is a powerful methodological approach used in research to enhance the credibility and validity of the findings. It involves comparing and contrasting different types of data to corroborate findings, ensuring a more comprehensive and robust understanding of the research problem. Other than that, mixed method research allows for sequential exploration of research questions, either starting with qualitative exploration followed by quantitative confirmation, or vice versa. Number 5 purpose why we need to do mixed method study is it helps in instrument development. By starting with qualitative exploration, researchers can ensure that their quantitative measures are grounded in the real-world experience and perspectives of the target population, leading to more reliable and meaningful research outcomes. Besides that, mixed method research is particularly effective for exploring complex phenomena because it allows researchers to capture different dimensions of a problem. By integrating qualitative and quantitative approach, mixed method provide a more comprehensive and validated understanding of complex issues that cannot be fully understood through one type of data only. This mixed method also can give impacts to policy implication. Policy implication refers to the practical consequences and recommendations that stem from research findings, particularly how these findings can inform, guide, or influence the policy decision and actions. When mixed methods research is used to explore complex phenomena, resulting in the change of policy according to the evidence-based findings. For example, previously, the result of 2-HPP less than 5.6 was considered normal in diagnosing diabetes, either type 2 diabetes mellitus or gestational diabetes mellitus. But according to the research findings lately, it has been changed to less than 5.1 millimole per liter, and this has changed the policy in diagnosing GDM or type 2 diabetes mellitus. Last but not least, through mixed method study design, it is able to contribute to a more holistic understanding of the research problem by acknowledging both quantitative and qualitative approach. Okay, now let's have a look on the types of mixed method study design. There are 4 types of mixed method study design. First, triangulation or convergent design. Second is sequential explanatory design. The third one is sequential exploratory design, and number 4 is embedded design.
First types in the mixed method study design is a triangulation. It also known as a convergent design. In this design, both qualitative and quantitative data are collected simultaneously, but the data had been analyzed separately, and then the result will be compared or merged to provide a comprehensive understanding of a research problems.
These figures illustrate how the convergent or triangulation mixed method study was done. So here, we can see that the researcher collect quantitative and qualitative data simultaneously, but they analyze the data separately. And later, the results been compared, integrated, and interpreted. This is the example of convergent or triangulation design. For example, researchers' objective is to evaluate the patient satisfaction and the quality of care provided by nurses in the hospital setting. So, for the quantitative component, they administer a survey to their patients upon discharge containing questions on various aspects of their care, such as regarding time, communication, professionalism, and also overall satisfaction. For a qualitative component, they conduct an in-depth interview to the same patients to gather detailed data on personal experience and perceptions on the care that the patients receive. For data integration, they compare and contrast the quantitative survey result with a qualitative interviews finding. For example, if survey data indicate high satisfaction with communication, look for corresponding themes in the interviews that describe positive communication experience. And the outcomes for this study will be they integrated the result after a more nuanced views of patient satisfaction, while quantitative data might show overall high satisfaction score. So it means that quantitative only shows high satisfaction score, but for a qualitative, we able to identify in which part that the patient had been satisfied, and be able to reveal the specific areas for improvement, such as the need for more empathetic communication or better pain management practice. Okay, second types of mixed method design is sequential explanatory design. This design starts with a quantitative data collection and analysis, then followed by a qualitative data collection and analysis. It is used when the researcher has an initial understanding of the research problem and wants to explore or explain of unexpected quantitative results. These figures illustrate how the sequential explanatory design was done. So here we can see that it started with a quantitative followed with a qualitative design. And then the data had been made a triangulation and the integration. This is the example of sequential explanatory design. So here, the objective is to explore the impact of nurse-patient ratios on patient outcomes, such as recovery times and patient satisfaction. In a quantitative components, they collect a quantitative data on nurse-patient ratios and patient outcomes from hospital records for at least 6 months. And then for a qualitative component, they conduct in-depth interviews with a subset of nurses and patients that were included in the quantitative phase. In this example, the data integration is they compare the qualitative data with quantitative findings to gain a deeper understanding of how nurse-patient ratios affect the patient outcomes. The quantitative data shows that lower nurse-patient ratios, for example, are linked to better patient outcomes. And the qualitative data reveals that nurses with fewer patients can provide more personalized care, leading to quicker recoveries and higher patient satisfaction. Therefore, the outcomes for this example is the integration of a quantitative and qualitative data provides a comprehensive understanding of the impact of nurse-patient ratios on patient outcomes. Example, lower ratios leads to better outcome, highlighting the importance of personalized care and manageable workloads. The third types of mixed method study is sequential exploratory design. Just now explanatory, now exploratory design. In this design, it begins with a qualitative data collection and analysis, followed by a quantitative data collection and analysis. And it is often used when researcher has a limited knowledge of the research problems and wants to explore in depth before moving on the quantitative research. This figure shows how sequential exploratory study design was conducted. Here have two validation of data. First, after qualitative data collection and analysis, and then they design an instrument for, and then followed with a quantitative data collection and analysis. At that time, here they did a second validation. Last is they interpret the data. This is the example of sequential exploratory design. The researcher's objective is to explore and identify key factors influencing effective nurse-patient communication and to develop and test a training program based on these factors. For a qualitative components, they explore the experience and perceptions of nurses and patients regarding nurse-patients communication by conducting focus group and in-depth interviews with nurses and patients. In terms of a quantitative components, they design a training program that address the key factors identified in the quantitative phase and implement the program with a new group of nurses and measures its effectiveness using pre- and post-training assessment. For data integration, the qualitative data provide a detailed understanding of communication, challenges, and effective strategies. The quantitative data shows that nurses who underwent the training program had significantly improved communication skills and higher patient satisfaction scores compared to the control group. And the outcome for this study is the integrated result indicate that the training program effectively enhanced nurse-patients communication by addressing the specific challenges and strategies identified in a qualitative phase. The last type is embedded design. In this design, it involves one type of data collection method being embedded within the other. One method takes a primary role and the other is secondary but is given sufficient weight in the study. So this figure shows how the embedded design was performed. For example, the objective of the researcher is to understand the public attitudes towards social issues using a quantitative data as a primary role. So in a quantitative component, they have developed a structured survey instrument with a closed-ended questions. They are using a large sample size to ensure statistical reliability. In terms of qualitative components, a subset of participants may be selected for the in-depth qualitative interviews to provide richer insights into the reasons behind their attitudes. Therefore, in this design, the qualitative component is embedded within the broader quantitative design, and the outcome for this study is integrate findings to provide comprehensive and holistic understanding of public attitudes towards the social issues. Okay, this figure shows summarize of 4 types of the mixed method study: how data have been collected, how the data have been mixed and interpreted to find the study outcomes. Okay, before you want to conduct a mixed method study, there are 4 key components that you need to focus. First, research questions and hypotheses. You need to formulate a clear and relevant questions and hypotheses that you want in your study. Second, sampling. Discuss the importance of diverse and purposeful sampling. The third one is data collection. Overview of qualitative and quantitative data collection methods. How you want to collect the data for a qualitative study or for a quantitative study. And fourth is a data analysis. Strategize for analyzing both quantitative and qualitative data. So we already discussed about what is the importance of mixed method study, especially in nursing fields. We also discussed about the type of the mixed method study together with the example. So everything in this world have strength and limitations, right? So do with the mixed method study. So for a strength of this mixed method study, it is a very practical approach to solve a complex problems of interest to the researchers. Other than that, it also allows researchers to use all qualitative and quantitative data gathering and analyzing the methods that are available. And it offers a flexibility in study design which allow researchers to explore complex phenomena in depth. Okay, what are the challenges in this mixed method study? So there is, because we have 2 data, right? So there might have an inconsistencies between a quantitative and a qualitative data. So, and then we also know that we need to do 2 design, qualitative and quantitative. Of course, it is very time and budget consuming. And last but not least is the researchers who want to conduct this kind of study, this mixed method study, needs to master in these 2 distinct different qualitative and quantitative research methods. Alhamdulillah, we already discussed everything that I think that you should know regarding mixed method study. We discussed what is the importance, what are the type, the most important thing is what are the type of the mixed method study, and we already discussed the example of the mixed method study and the strength and limitation of this design. So is there any inquiries? You can leave your comments in the comment section, or you can email to my email address azlinajazli@uitm.edu.my. So with that, thank you so much for your attention. Bye. Assalamualaikum.